The eyes are the #1 feature people recognize the most. So it's a very important feature of the face. It shows the aging changes much sooner than the lower face. So typically eyelid surgery will begin in the 30s, 40s, sometimes even younger. It all depends on heredity and what we're seeing. But the nice thing about eyelid surgery, I tell patients, is it's quite often once you do it, you may not ever have to do it again, which is nice. So it is one of those, not to say never, but often. It is one of those procedures where you can enjoy those results the rest of your life. I mean, upper eyelid surgery is pretty straightforward. The main thing there the surgeon must understand is how much skin he can safely remove, obviously, so that you're not distorting the eye or the eyes are too tight. The other thing that's important in relation to the upper eyes is how is the eyebrow affecting the upper eyes? Because many times there's a lot of brow heaviness too. So if you just do the upper eyes, patients may feel like there's not enough change there, I'm still heavy. So you have to educate them that part of what they're seeing is the brows. The lower eyes we tend to operate on more when patients present with puffiness, wrinkles, and there's several procedures we do there. Probably one of the staples is what's called a transconjunctival blepharoplasty, and what that means is I avoid any external incisions. The incisions are all on the inside. And what that allows me to do is to sneak behind the muscle so I don't have to cut the muscle, which is the main ligament which holds that eyelid in place, so it minimizes any risk of changing the shape of the eye. But what I do is, by going internally, is I recontour the fat pads in there to get everything to lay flatter. And then on the outside, what I often do is use laser resurfacing, because it will do two things for us. It tightens the skin, just as if I was excising skin, but the laser also has the advantage of smoothing wrinkles. So it does both. Because if we just tighten the skin by excising it, it really doesn't help with the wrinkles. If I'm doing upper and lower eyelid surgery, it's about a 45-minute procedure, so it's not all that long. Patients recover for about an hour, go home. The sutures in the upper eyes are very fine sutures, and they come out in 7 days. They can often do makeup the next day. Patients feel fine the next day. It's really not a painful procedure at all. So it's a very quick recovery. If they do laser, typically they got to wait about 10, 11 days before we can get makeup on.